Good morning, students. So, we'll continue with our previous section where we were discussing on plasma proteins. Yes, the proteins which are present in your blood, and also we have discussed what are the different components which are present in your blood. Okay, which makes up the plasma, and also we have seen what is a plasma and what is a serum sample. Yes. Next, we have seen in just as a classification what are the different components in the blood or the plasma, which includes the major portion as the water molecules. Then you have organic compounds. Okay. Then you have the albumin, which is the main colloidal substance or the protein, and then other fragments of the proteins. Yes, and also we have seen what are the different methods by which you can separate the proteins from the given specimen or the sample. Like you can use the salts or you can use the alcohols, right? And you can use the techniques like, for example, electrophoresis or even chromatography. You can use for separation of the proteins or any biological substance from the body. Okay. Next, the different fractions of the protein, the total protein in the serum or plasma are these 5 components. The major portion up to 55% is albumin. Okay, the major portion of the plasma proteins is the albumin. Next, you have alpha 1. Here you can see when you run the electrophoresis, the proteins are or the sample is applied on this side at the negative node. Okay, you apply one sample, this much of serum sample, you are applying a plasma sample. Once you connect to the electric circuit in the electrophoresis, because of the movement of the electrons, yes, movement of the electrons from negative node to positive node, along with the electric current, it will carry the protein particles as well. Okay, it will carry the protein particles as well along with it. So during that process, what happens? The protein also migrates along with the electric current, because we all know protein contains either of the charge. It contains the either the positive charge or it contains the negative charge. Yes, we all know protein. It's a long chain amino acid polymerization with the peptide linkage, and the charge on the R groups will determine what is its charge. If it is plus, most of it is plus, or it is most of it is negative, the total overall charge on the protein also will carry either positive charge or negative charge. So when this is the situation, when you put this protein sample under a circumstance where electric current is passing through it, it starts migrating along with the electric current. Okay, if protein is more of negative charges, okay, protein is more of negative charges, what happens? It will also start migrating. Okay, it will start migrating towards the positive node. So while the movement based on their total number of charges, how much charge it contains as negative, yes, total negative charge, its molecular size. Okay, is it molecular size or the molecular weight? Is it bulkier or lighter? Bulky means it will run slow. If it is lighter, it will run fast. That is, the movement of the protein from negative to positive node is either slow or fast based on charge and mass. So the electric mobility, the electrophoretic mobility is determined by these two things. The molecular size, if it is more bulkier, it runs slow. If it carries less negative charge, then less negative charge means attraction towards positive also will be low. Yes. So that is the reason the movement is also affected. So when we see such pattern, we see from negative to positive node, the one which runs very fast is the albumin. Next part of the total protein which runs next to the albumin is called as alpha 1. alpha 2, beta and gamma. Gamma are most commonly the immunoglobulins. Okay, immunoglobulins are antibodies. What you know as the very basics are the ones which are very bulkier. So bulky means they run very slow. So based on that electrophoretic pattern, the total protein, okay, the total protein can be divided under 5 fractions. What are those fractions are? These: albumin, alpha 1, alpha 2, beta and gamma portion of the total protein. Okay. Now individually, what are these made up of? Like for example, alpha 1 globulins, they are made up of different components. What are those? Like alpha 1 antitrypsin. Okay, alpha 1 antitrypsin or alpha 1 acid glycoproteins, or it is alpha 1 lipoproteins. Okay, so these are the different components of what are present in the alpha 1 globulin. When you see the electrophoretic pattern, albumin because it's high concentration, alpha 1, alpha 2, beta and gamma. So alpha 1 portion, this portion is made up of what type of proteins is these: alpha 1 antitrypsin, alpha 1 acid glycoprotein and alpha 1 lipoprotein. Now on electrophoretic pattern, next band, what you see, that is the albumin, alpha 1, alpha 2, beta and gamma are the uh, patterns, okay, from negative to positive node. The next is the alpha 2 portion. What does the alpha 2 portion contains? What different proteins are part of this? It is not a single protein. It is group of protein which can be fractioned. Okay, which can be seen as a fraction. What are those? The alpha 2. If you take out this protein and see what it contains, it contains these kind of protein. That is like ceruloplasmin, which is a copper carrying protein. Okay, it's a transport protein which carries the copper, okay, in the body or in the blood. Then alpha 2 macroglobulins and haptoglobulin are the different fractions of alpha 2 globulin. Now next, albumin, alpha 1, alpha 2 is over. Now what are the beta component? Beta component is made up of these 4 fragments again: beta lipoproteins, transferrin means it transfers the iron, hemopexin, and some of the immunoglobulins are part of the beta globulin. Means beta globulin is further made up of these proteins. Okay, it's just a fraction, it's not a specific protein. Okay, it's not a specific protein, it's a fraction seen on the electrophoresis. So in this fraction or in this area, what proteins you identify is these proteins. Okay, next coming to what are the different functions of this protein, why these are present, what is the utility of that? One, if you have completed in your physiology the blood and the fluid mechanics, you might have come across something called as osmotic pressure. Okay, osmotic pressure, colloidal osmotic pressure means what? Like for example, if you take the very basic of your science, you have one semi-permeable membrane. Okay, you have filled both the side, A side and B side, with the water molecules or water. Okay, and then you add the salts. Okay, you add the salts in one chamber, B section. There is no salts here. What happens to the water molecule? The water molecule will move, or these salts will pull the water molecules towards it. If there is less amount of salt molecules, what happens? The water escapes from its chamber. Actually from A, water is moving to B, means B is gaining the water, sorry, B is gaining and A is losing. And this is maintained. Okay, in A also there is some amount of salts, like here it has only 10, here it has 15. So because of this maintenance, the water molecule inside this chamber is also maintained. So that you have learned under the sections called as ICF, ECF, that is intracellular fluid and extracellular fluid compartments. So to maintain the compartment of fluids, otherwise what happens if there is no maintenance of the compartment fluid? all the water molecules from your blood will get escaped into the peripheral tissue. So what happens? Your blood vessels become narrow. There is hypovolemia, decrease in the volume. So to maintain that, you have the major protein which contributes is the albumin. Okay, if there is reduction in albumin, you might see presence of edema. What do you understand by edema is the diffusion of the fluid into extracellular matrix. Like for example, you might have seen people might have the uh, swollen feet. Okay, there is bulky feet. You and when you press it, you might see it is pitting type. Okay, most of the type of edema what you see in the people with edema is pitting type. Okay, next it the protein which is present in the blood also acts as one of the function transport protein. Means what? It transports the albumin. Albumin helps in the transport of like fatty acids, okay, lipids, that is fatty acids. It also carries some steroids hormone. It carries the bilirubin. It carries the copper. Means the proteins which are present in your blood, the plasma proteins, has a transport function as well. And other proteins like transferrin carries the iron. Then you have RBP. Okay, that is the retinol binding protein, which helps to bind to the vitamin A and transporting of the vitamin A. Then lipoproteins, they are also part of proteins which carries the lipids. Means all these plasma proteins has second function. First function is colloidal osmotic pressure. Second function is the transport function. Transport function, these are the examples. Then, because we know protein is made up of what? Amino acids. Amino acids can be ketogenic or glucogenic. Means what? They provide the nutrition. So, the plasma protein, what is present in the blood, is also functioning as nutrient to the body. Next, buffering capacity. In the previous classes, we have seen that amino acids and proteins have ampholytic nature, and because of which they functions as a buffer. And what are buffers? Buffers are any solution or solvent which resists the change in the pH. So this much clarity we have. Okay, that is buffering. Next, the gamma portion, as I told, it contains immunoglobulins like IgA, IgG, M, E, D. Okay, so these immunoglobulins are defensive in system. Means they neutralize or help to neutralize the exogenous toxic compounds or the pathogens which have entered. Okay. Next, it also, because of the colloidal system, it maintains the viscosity of the blood. So these are the functions of the plasma proteins which can be asked for a 5-mark question. Okay, in the 5-mark question, they'll ask you what are the different fractions of plasma protein on electrophoresis. That is, you have tried albumin, alpha 1, alpha 2, beta, and gamma. Okay, it is always better if you draw the electrophoretic pattern as well. Okay, then what are the functions? Okay, same part of that will be what are the different functions of the plasma proteins. Okay, so this will become a 5-mark question which is routinely asked in the exams. Clear? Next, only albumin can be a 3-mark question. What you should know in this albumin, we'll only discuss that. Okay, albumin. One thing you should always know. Total protein in the blood, major portions are only 2. That is albumin, globulins. Now we have seen globulin is further has different fractions. Alpha 1 globulin, alpha 2 globulin, beta globulin, and gamma globulins. Okay, on electrophoresis, it has 5 patterns. But otherwise, if you see as a total protein is nothing but albumin plus globulin. Okay, albumin plus globulin is the total protein of your blood. So what is albumin? Albumin is the major protein. How much is it present? The normal value of total protein, albumin, globulin are important 3-mark question. Okay, total protein is 6 to 8 grams per dl. Always remember proteins are present in blood as grams per dl. Okay, grams per dl. In when it comes to albumin different book gives different values. Simple is you can remember 3.5 to 5.5 grams per dl. Okay, and globulin will be around sorry 2.5 to 3.5 grams per dl. Okay, these are the normal values of the different fractions of total protein, that is albumin and globulin. So albumin is major portion. If you see here, it is made up of up to 60%. The total protein, if it is total protein is 100%, 60% is albumin plus 40% will be your globulins. Okay, 60% of the blood is made up of albumin because albumin has a more important function, that is the colloidal osmotic pressure. Colloidal osmotic pressure. What is the half life? It is 17 to 20 days. Okay, albumin has a half life of 17 to 20 days, and we have seen on electrophoresis also it migrates very faster. Okay, because it is rich in the negative charges, and also when compared to globulins, it is lightweight. So because of these two fraction or these two characteristics, it runs fast on the electrophoresis. Okay, when it comes to synthesis, I don't think you need to know the synthesis, but one thing you should know, albumin is only synthesized by liver. No other organ can synthesize the albumin in the body. If liver is failure, okay, if there is failure of liver, what happens to albumin levels? Yes. Will it decrease? Yes. Whenever there is liver damage because of various reasons, it might be infections like hepatitis infections, or it can be self-made alcohol consumption. Okay, alcoholic hepatitis or alcoholic liver cirrhosis or hepatic failure, anything. Okay, under such circumstances, what happens? Your liver cannot synthesize, or the synthetic function of the liver is reduced. Okay, the synthetic function of the liver is reduced, because of which there is reduction in the albumin levels also. The synthesis of albumin also reduces, and in such patients you might see presence of the pedal edema as well. Okay, pedal edema as well, because albumin has one of the important function, that is COP, colloidal osmotic pressure. Okay, structure of albumin you did not know. Function, as I mentioned, it is one of the important protein for colloidal osmotic pressure, which helps to maintain the fluid in different compartments. Okay, you have ECF, ICF, so all that compartments, the fluid has to be maintained. Okay, the fluid has to be maintained in their own particular compartments. So that is one of the important function is albumin. So whenever there is hypoalbuminemia, hypo means reduce. So whenever there is reduction in the albumin levels, because of which there is decrease in colloidal osmotic pressure, because of which the water molecules from the blood is escaping into the extracellular fluid compartment, because of which what happens on the peripheries like limbs, you might appreciate the presence of the edema, which is pitting type. Okay, pitting type of edema you can experience in these cases. So other functions like it, apart from COP, colloidal osmotic pressure, it helps in the transport function of fatty acids, calcium, bilirubin, certain steroid hormones, copper, and other drugs. Okay, various drugs also are carried binding to the albumin. Means albumin acts as one lorry. Okay, it will carry the material whatever it want to carry. Okay, it will carry either free fatty acids, it will carry the calcium, it will carry some steroid hormones, it carries the bilirubin to the liver. Okay, bilirubin to the liver so that it can be removed from the body, or it carries the copper, or it carries various other drugs. Okay, albumin helps to carry these components. Okay, transport function. Next, as any protein, albumin contains various other amino acids, so it helps in the nutrition, it helps in the buffering capacity, viscosity, which we have seen in the last section also, and it cannot cross the blood-brain barrier. Okay, albumin cannot cross the blood-brain barrier, because of which bilirubin, when it binds to the albumin, okay, albumin bound bilirubin in the newborns, if the bilirubin in the brain, okay, if it crosses the blood-brain barrier, the bilirubin damages the brain tissue, basal ganglia. Okay, basal ganglia of the brain is damaged, because of which patient will develop a particular syndrome called as Kernicterus. Okay, so the albumin has so much of importance. The bilirubin which is carried by the albumin can cross the blood-brain barrier and cause kernicterus, and this is most commonly seen in newborn with increased bilirubin levels, hyperbilirubinemia. Okay, some amount of the calcium is also bound with the albumin that we have seen in last class. Okay, these are the causes. Like, what are in the exam? They'll ask you for 3-mark question. What are the causes for hypoalbuminemia? Means reduced albumin levels, that is 3.5 to 5.5, less than 3.5 to 5.5 gram per deciliter. Like, as I mentioned, liver is the only source of albumin. So whenever there is damage to the liver, like cirrhosis, obviously there is a reduction in the levels of the albumin in the blood. Malnutrition, like if you don't take in the diet, how you get amino acids if you don't take in the diet? It will reduce, right? When there is reduced amino acid intake or the nutrition, obviously the person will have reduced total protein, and consecutively he will have reduced albumin levels in the blood as well. Okay, then there is something called as nephrotic syndrome, that is with respect to the kidney. We all know what is the use of the kidney. It helps to form the urine. Okay, it's not so simple. When you are learning the renal system, you will be understanding what is the function of the renal system. Normally, proteins are not excreted in the urine, but under certain conditions like nephrotic syndrome, you might see protein is excreted in the urine. So when they are excreted in the urine, obviously blood level, what happens? It starts reducing. So it causes hypoalbuminemia, decrease in the blood level because of loss of the proteins in the urine in a condition called as nephrotic syndrome. Next, burns. Like, there is a burn patient, so because of the loss, okay, they'll have decrease in albumin, and also because of this sudden shock, the liver will not be able to produce the sufficient amount of protein. Malabsorption. You are taking appropriate in the diet. Okay, dietary amino acids appropriate, but the GI tract is not absorbing. If there is no absorption, obviously there is decrease in the total protein and decrease in the albumin. And there are some certain congenital conditions, okay, where there is reduced synthesis of albumin itself. Okay, you might find there is no albumin, but there are very less chance where there is increase in the albumin levels. Okay, there are plenty amount of reasons for decrease in level, decrease in albumin, but there are no much reasons for increase in albumin, except whenever there is hemo concentration, means the amount of blood volume, the water molecule is reduced, so there is relative increase in albumin concentration because of decrease in the water molecules, decrease in the water compartment, fluid compartment. That is called as hemoconcentration. So under such conditions, you might see there is increase in albumin, but routinely there is no increase in albumin. It is only decrease in albumin, that is hypoalbuminemia. Okay, in the exam, they will be asking you for 3-mark question. What are the different causes for hypoalbuminemia? You should be able to write 4 to 5 examples: cirrhosis of liver, malnutrition, and malabsorption. Okay, either person is not taking the diet properly or his GI tract is not absorbing the amino acids. Two causes. So total three. Then increased loss in the urine. Okay, that is nephrotic syndrome. There is increased loss in the urine. So that all causes the hypoalbuminemia. Okay, next comes is the globulins. Globulins, as I mentioned, total protein contains albumin and globulin. So globulins are bulkier when compared to amino acids. What you should know in this is it contains four fractions, which you have seen on electrophoresis, right? Albumin, alpha 1, alpha 2, beta, and gamma. Okay, alpha 1, alpha 2, beta, and gamma. All these are gamma globulins. They all come under globulins. Okay, they all come under globulin section. Okay, synthesis of globulins is all not required. Okay, individual things. Actually, I have got the exam duty, so I'll stop it here only. Fine. Next class we'll continue with the